Gastric cancer. How much do you really know about it? Would it surprise you to tell you that it is the 6th commonest cancer of the lot, and of all the cancers that can actually kill you, it is one of the top 3 cancers that will kill you. So what about gastric cancer? Well, firstly, it's more common in Asia than it is in the Northern Hemisphere. That's very important because we are in Malaysia. What symptoms do you get with gastric cancer? Unfortunately, it is one of those cancers that has very little symptoms. And often if you do have symptoms, it means things may have progressed. What are the symptoms? It can include stomach pain, your standard gastric symptoms, reflux, vomiting, weight loss, anemia, bloating. All this and more are the risk factors. But then now what do? You get some risk factors, you run to the doctor every time you have a stomach pain. No, don't do it that way. Put it in context. Risk factors. What are the risk factors to gastric cancer? Now, you have a risk factor and you have one of these symptoms, then perhaps you should run to the doctor. Risk factors, 6 things. Number 1, smoking. The more you smoke, the more your chance of gastric cancer increases. Yes, it does affect your stomach, not just your lungs. 2, H. pylori infection. It's a bacteria that you can get that increases the risk of gastric cancer. 3, the type of foods you eat. Salty food, smoked food, pickled vegetables all increase your risk of gastric cancer. 4, previous gastric surgery. 5, pernicious anemia. And 6, plain old genetics. So if you have symptoms and perhaps a risk factor, then you should take your symptoms very, very, very seriously. Now, even if you have no symptoms but have a risk factor and you're concerned, go see your gastroenterologist. We done? Okay. Wait. One more thing. Gastritis. Everybody's got gastritis, and does it mean you got gastric cancer? Well, I'll put it in perspective. Your 20-year risk of having gastric cancer if you have gastritis is as such. If you got normal gastric tissue, your chances is 1 in 250. If you got gastritis, risk of gastric cancer is 1 in 80. If you got chronic gastritis, so the layer of the gastric lining is thinned down, your chance of gastric cancer is 1 in 50. 1 in 50 and 1 in 250 is a big difference. So the symptoms of gastritis, that the stomach pains, you think it comes and goes, perhaps you're being ignoring. Maybe it's about time you take it a little bit more seriously. If you found this information useful, I'm sure someone else will too. Feel free to share it.